Acne. Acne is probably one of the most common things that comes to the spa or med spa. It's extremely common. And acne is a condition or a disease or whatever you wanted to call it from the follicles. There is a follicle, and inside the follicles there is a secretion which is called sebum, and the sebum comes off of the follicles and go on the surface of the skin, covers the skin. So far everything is good. There is something that is called retention hyperkeratosis. Retention hyperkeratosis. Retention hyperkeratosis. Retention hyperkeratosis is this. On the surface of the skin, we know the skin exfoliate. Exfoliation on the surface of the skin. And as we know, every 28 days, there is a new layer of the skin that is coming, and in a young adult, they exfoliate. The exfoliation of the skin, if it's happened on its own, we call it desquamation. Desquamation. And if we enforce it with some kinds of chemical or some kinds of treatment or whatever, we call it exfoliation. So exfoliation is when we expedite or we enforce the exfoliation of the surface of the skin. And there is another term which is called peeling. Peeling is a term that is used mostly on the medical spa or med spa, that is peeling and removing the layers of the skin. So desquamation is the word. So on normal skin, we have exfoliation, let's call it exfoliation on the surface of the skin, that is happening all the time, every 28 days in a young adult. Now, what about inside the follicle? And as you know, inside the follicle is an extension of epidermis inside the dermis. So the wall of the follicle inside, it is part of epidermis, and they are exfoliate too. So inside the follicle there is exfoliation, and the exfoliation or the pieces of the epidermis or the skin that is exfoliate inside the follicle, along with the sebum, they are coming off of the skin of the follicle and leaving the skin. So far is good. Retention hyperkeratosis is a condition that this exfoliant, the cells that exfoliated from the skin from inside the follicle, they mix with the sebum for some condition, and instead of coming off of the follicle, they clog inside the follicle. So they start piling up inside the follicle. This condition is called retention hyperkeratosis. Retention hyperkeratosis is the first sign of acne. But the problem is, unfortunately, you cannot see retention hyperkeratosis because they are inside the follicle. So this is the retention hyperkeratosis, and retention hyperkeratosis is the first seeds of acne that's happened inside the follicle. Okay, so that's the retention hyperkeratosis. Now, what is the first sign or the first sign of the acne? We have two terms here. One is closed comedone. So one is closed comedone and one is open comedone. Let's first talk about closed comedone. This is a follicle, and the sebum is inside the follicle, the fat and hyperpigment and sebum is inside the follicle, and retention hyperkeratosis happened here. The cells, they are here plus sebum, and they are coming and closing, blocking or clogging the follicle. In this format, we call it closed comedone. Closed comedone is closed comedone. Closed comedone is Closed comedone is when the retention hyperkeratosis or dead skin cells plus sebum, they are coming together and they are clog the opening of the follicle, and is called closed comedone. Open comedone is when the retention hyperkeratosis, these cells, dead skin cells, they are piling up on each other. They are narrowing the follicles, all over the follicles, but still the fat has access to the outside of the follicle. So the fat or the sebum, it has access to the follicle, it comes off of the follicle, and it is exposed to the air, and when it's exposed to the air, it's oxidized and becomes open comedones. So closed comedone, open comedones. That's the difference between comedones, open and closed comedones. So far it is closed comedone and open comedones. The next step is when we have the same follicles, and the follicles is closed. Retention hyperkeratosis happened and the cells, they are piling up on each other. They close the comedones or follicle, and now there is an accumulation of sebum inside the follicles. The sebums are here accumulated. Now there are pressure from the sebum, and they may start to leaking from the follicle wall into the skin, and when they are going into the skin, they are making something that is called inflammation. And we have inflammation here because the content of the cells, they are off of the follicles, and the body try to defend and send inflammatory cells to this area, and we have inflammation. And now we call this inflammation that is happened, we call it papule. So papules are when there is inflammation, the content of the follicle, they are leak in between the skin, the cells, and now the inflammatory cells come and becomes papule. Before going any further, let me talk about a microbe that is in this area, and the microbe is called P. acne. P. acne or Propinium acne. Nowadays they call it C. acne. So P. acne and C. acne, they are the same, means cutaneous acne or Propinium acne. There are some microbes that they are living normally in the follicles, and in healthy follicles they can easily get off of the skin, and they are living with the sebum off of the skin, and there is no problem with the follicle with these microbes. But when we have closed comedones, or when we have closed comedones, these microbes, they are still here, and they are anaerobic microbe. It's called anaerobic, means they don't like air. They cannot survive in air, so it's called anaerobic microbe. So when the comedone is closed, what's happened? These microbes, they don't have oxygen, and they love this condition, and they grow, and they becomes too many, and they are releasing some kinds of chemical, and that chemicals from these microbes, they lyse or they damage the follicular walls, and now the microbes, the P. acne microbes, damage the follicular wall, and they are in the skin plus the sebum plus the cells, the dead cells, and that makes inflammation, that we call this inflammation papule. That's the first signs of the signs of acne that we can see. So closed comedone, open comedones, and papule or inflammation. Which one of these are more prone to be full-fledged acne, closed or open comedone? Definitely the closed comedone is more prone to be an acne because it's already closed, and the microbes that don't like the oxygen, they can grow, and these closed comedones, they have more chance of become acne than these open comedones. So the open comedones is also called blackhead because the sebum that exposed to the air, they oxidize and becomes black. We call it blackhead. And the closed comedone, because it is only the dead skin cells and some debris, we call it whitehead. So whitehead and blackhead, and now we have papule. After papule, we have another stage which is called pustule. In that stage, the follicle is still here, and the sebum, it is clogged, closed. The sebum is inside the follicle, sebum, and microbes, P. acne or C. acne microbes, there are a lot of them inside the follicles, and they leaked from the follicle in between cell, and now the body is coming and fighting these everything that is inside this in between the skin, means dead skin cells, sebum, microbes, and everything. And the dead body and the accumulation on all of these things makes something that we call them pus. They make something that is called pus. And now we can see there is a pus which is called pustule. Now there is pus, means dead skin cells, the defense of the body, we call it pustule. Pustule is when the body, when the body try to defend itself against all these dead skin cells and inflammation and microbes and everything. The next step is after the pustule, because there are so many pus and there are so many things that they can damage the skin. They can really, if they get into the bloodstream, they are very, very toxic and they can be damaged to the skin. The body comes and make another defense mechanism. The next defense of the body is, so there is the sebum is clogged, sebum, microbes, P. acne, everything, they are coming all over here with dead skin cells, with microbes, with defense of the body, with inflammation, everything. The body comes and makes a kind of sac around all these things. Now everything is covered around a sac that we call this sac, we call it a cyst. A cyst is a condition that defense of the body defends itself by these sacs around, or cyst, around all this mess that is around the follicle. The body comes and make the cyst. But the problem with this cyst is the microbe is already releasing some lysing enzyme. The defense of the body, or the inflammatory cells, they are here and they want to lyse these microbes, the microbes that they are everywhere, and they are secreting some other enzymes, which is called proteolytic enzyme. The proteolytic enzyme that they are here, they are damaging all the tissues and everything that is around these sacs or this cyst. So the whole thing is called cyst. Everything inside it is kind of damaged, and that's why we see a big scar after a cyst, because microbes, inflammatory cells, everything, they are defending, they are fighting, they are releasing all kinds of enzyme and everything, and the whole thing is damaged. It's just like a wound, a big wound inside the skin, and it becomes cyst on, and eventually this one becomes a scar, an acne scar. And sometimes the whole thing is a little different. It goes like the follicle is like here, and the follicle is here, Everything again the same, the follicle is clogged, the microbes and inflammation and everything again is happening. Inflammation, everything is happening. Microbes, P. acne, lysing, everything is happening. All of this happen, but they are deeper inside the skin. They are deeper inside the skin, so we call these nodules. So nodules is the same as cysts, but they are much deeper inside the skin. On the cyst we can see it, but on the nodule you can feel it. Cyst and nodule and pustule, they are painful, and that's the characteristics of this section. Papule, nodule and cyst, they are painful, and they are already too far in treatment that they need a medical treatment. We cannot treat them with not normal skincare treatment, normal spa or even med spa treatment. They have to be under some treatment because of all the things that happen. The main problem with acne is the scar, and that's why we are so afraid of acne. And acne is happening mostly on the young people, and a scar stays for the rest of their life, and it's extremely difficult to treat the scar of acne. And that's why on this stage, and usually when it comes to cyst or even nodule, the doctors give the patient, or even on the pustule section, they give them treatment that probably you've heard about. It's called Accutane. Accutane or isotretinoin is another name. Accutane or isotretinoin. Accutane or isotretinoin is very strong treatment, and sometimes you have to, or doctor has to give to the client, because otherwise the client gets a scar on the face, very important, and it is inevitable to give Accutane or isotretinoin starting on this stage, or even sometimes on this stage, depend to the case. The main problem with acne, and the thing that scares us and we don't want, is the scar that happen after acne. And because most of the client and almost all of the client that comes for the acne, they are very young. They are young teenager, young age. So we try to avoid scars by any means. And when it comes to this stage, cyst or nodules or even pustule, we don't have any much option. So that's why doctor gives a very strong medication like Accutane or isotretinoin that is coming after cyst or nodule. We have to, doctors has to give these things. And when it comes to the pustule, doctors usually gives antibiotic to kill the microbes. Essentially, we are trying to help the defense system or defense mechanism of the body by giving the client or patient some kinds of medication. So we have closed comedone, we have open comedones, we have papules, pustules, cysts, and nodules. These are the stages of acne that is happening. Now, why acne is happening? Let's go to the whole physiology of the acne. These are all about the signs and symptoms of acne. How many types of acne exist? There are two types of acne. One is called the juvenile acne, juvenile or teenage acne, and the other one is called adult acne. Juvenile acne or adult acne is different. Juvenile acne is usually happen on starting from puberty all the way to 24 to 25 years, on sometimes even that ballpark of 24, 25 years, and it's happening and mostly on the face, and this is mostly on male dominant because it is related. It is part of it is the male hormone testosterone that goes for the juvenile or teenage acne. It's very common among male boys Adult acne, on the other hand, is more common on the female client, age 35, ballpark 35 and a little older. This is because of the fluctuation of the cyclic hormonal fluctuation happen in female. So juvenile acne and adult acne. So the causes of acne. The first one is hormonal, which is hormonal fluctuation or hormonal change of adult acne that suddenly increase the secretion of the sebum. So the sebum that used to be like this, the follicles, and it used to produce some sebums, and all of a sudden the production of sebum is way over the capacity of follicles. So we have overproduction of sebum. That's happened mostly in boys and in young male client. So one is hormonal that happened in juvenile or in teenage acne that's happened on the follicle. The second the second cause is inflammation. Inflammation is another cause that can make acne, and that's why anti-inflammatory is a major part of the treatment of acne. So for every treatment of acne, we have to have one anti-inflammation products. The third one is the thing that we call it retention hyperkeratosis. And that was clogging these follicles, retention hyperkeratosis, or clogging the follicles, or exfoliation. This is another cause of acne. And the other cause of acne is a microbe that is called P. acne or C. acne, the same. P. acne or C. acne is the microbes that is living inside the follicles, and if you don't take care of them, they can expand, they can grow, and they release some kinds of enzyme, that the enzyme goes and lies the wall of the follicle and makes kinds of inflammation and all these problems. For hormonal, mostly we cannot do much on the hormonal treatment, because for a young male or young female, we don't have some more option to do anything for hormonal. But for inflammation, we have some anti-inflammatory medication. I'm talking about anti-inflammatory treatment that we talk about. For retention, we have some options. Retention hyperkeratosis, we have some option that expedite or increase the exfoliation of the skin. And for P. acne, we have some treatment. Now let's go on talk about the acne treatment, which is important. The treatment of acne, let's first focus on the treatment of the P. acne or propinium acne. Inside the follicle there is a microbe. If this is the follicle, inside the follicle there is a microbe which is called P. acne. And this P. acne, as I mentioned before, this P. acne, they hate oxygen. They don't like air. If they're exposed to the air, they die. So there is a treatment that is called benzoyl peroxide. Benzoyl peroxide or benzoyl BPO. Benzoyl peroxide. Benzoyl peroxide is activated oxygen. When you apply it, probably you've seen this benzoyl peroxide on many medication, on many treatment of acne. When you apply the benzoyl peroxide on the skin, what's happened? The benzoyl peroxide goes here and it releases oxygen. And oxygen kills these microbes. And that's why you are using benzoyl peroxide on acne. Specifically the kind of acne that they are inflamed, like papule, because that kills the acne. The other treatment that is very, very important is salicylic acid. Probably you've seen salicylic acid as a main ingredient in treating acne. What does salicylic acid do? Salicylic acid is an exfoliant. Means when you apply on the surface of the skin, it removes some layer of the skin. So some layers of the skin is removed by salicylic acid. Exfoliate the layers of the skin. Now there is more chance that the oxygen can get into the follicle, and also the sebum and whatever is inside the follicle can get off of the follicle and help. So salicylic acid is a major treatment in mild to moderate acne. Also benzoyl peroxide, mild to moderate acne. Salicylic acid is also an anti-inflammatory. We talk about it. And inflammation is a major portion of this acne. So salicylic acid is an anti-inflammatory. Also alleviate the inflammation. If you remember, we talk about these cells, the microbes, that they leak in between the skin cells, and they triggers inflammation. This inflammation is okay, but those inflammatory cells that they are coming from other parts of the body, from the blood, they are coming here. These inflammatory cells, they are trying to defend these microbes, but the problem is these inflammatory cells, they also secrete some enzyme that those enzyme also kills the bacteria, the P. acne, and at the same time damage the collagen and elastin and everything that is in the skin and makes a scar. So we try to tell them, to this inflammatory cell, please come down, don't worry, it's okay, we know there is acne, we know whatever, and it's self-limited, so it goes away. Don't damage, at least not you. We have enough damage from these microbes, please come down. So anti-inflammatory, which one of them is salicylic acid, is really helpful in treating acne. Salicylic acid is anti-inflammatory and P. acne. So along with salicylic acid, which is called BHA, there is a group which is called BHA. Salicylic acid is a BHA. We can use AHA, or alpha hydroxy acid. So alpha hydroxy acid and beta hydroxy acid, or salicylic acid, both of them, they can treat and they can remove this, exfoliate the skin, and also when you apply this on the stage of comedones, it's really help. And that may be the only treatment that you may need for comedones, specifically closed comedones and open comedones, because they go and they lyse and they release the retention hyperkeratosis that's already inside the skin. Specifically beta hydroxy acid or salicylic acid. Salicylic acid and beta hydroxy acid, you can consider them as one, and they are oil soluble. Means they can get into the follicle because the content of the follicle is sebum, and sebum is oil, so they need an oil soluble. So salicylic acid is oil soluble. It can get into the skin, into the follicles, and it can dissolve the retention hyperkeratosis, which is extremely important. So the treatment for the mild to moderate acne is salicylic acid, exfoliation, AHA, BHA, probably microdermabrasion. You may use microdermabrasion or some treatment like that, but the problem with microdermabrasion is they may make some inflammation. So microdermabrasion may work, but you better to use some kinds of chemical exfoliation like salicylic acid or AHA and BHA to treat mild to moderate acne, means closed comedone and open comedones. Does extraction help? Definitely extraction helps. because when you can open, if you can open this opening of the follicles, and if you can help the skin, the follicles, to get rid of all these mess that's happened inside the follicles, that definitely helps. So extraction is really, really effective in closed comedone, open comedones, and also in papule. But some extraction that is done not professionally, what they do, they push on this side of the follicles, and what they do, if they are not done professionally, they push this material, all this mess, to go even further from the skin. And that's why the people who are picking at their comedones or acne, they are making a big problem. And that's why picking the acne is extremely bad, specifically for the people who are picking at the acne and they make inflammation. So we try to avoid inflammation. And those who are picking at their acne, they are inducing inflammation. They are pushing and they push all this mess to get the other side of the skin and makes inflammation. It's called acne excoriae. Acne excoriae is the terms that is called for the people who are picking at their acne. And you can see on the skin analysis, you can easily see who is picking at their acne. And picking at the acne in the skincare industry is a kind of emergency. When you see somebody who is picking at their acne, it is not intentional. Most of the time it's happened during the night when the people, because kind of itching or pain at the night, that they are picking at their acne. So just by saying don't pick at your acne doesn't work. So that's why there are some patches that you can have the patch to cover the skin, the acne, the comedones, and this patch not only prevent the picking at the acne, at the same time they have some kinds of treatment that the treatment can help the acne. One of them is a kind of like clay mask. It's not clay, but it's a kind of products that they go on the surface of the skin and they are sucks and absorb everything from the acne, and they are really, really good. They are suck everything from the acne and they are opening the acne. And some of them, they have salicylic acid. The salicylic acid that you can use out of the counter is only 2%. So 2% is out of the counter salicylic acid that you can use these days. You can see it in many places. And also the one that we use as a spot treatment. Spot treatment that means that you put something on the acne and you wish the acne to be treated, and that is 2% salicylic acid. 2% salicylic acid goes here, exfoliate, anti-inflammatory, penetrate to the skin, open the hair, open the follicles, and it's really a wonderful treatment. And also don't overlook using this pad on the skin. This patch on the skin, they are skin color and they are not even noticeable when they are using on the skin. Now that we know salicylic acid, we know benzoyl peroxide, we know how they work, and we have the skin. And now how to recommend? We have two kinds of products. We have leave on and we have wash off. Leave on and wash off. So wash off are the kinds of product that you put on the skin like cleanser. You use on the skin and then cleanse it, remove it. This is called wash off. When you have a new client, first you need to use wash off products to kind of introduce the skin to the new product. For instance, salicylic acid or benzoyl peroxide, because these products, they are drying. They are opening the skin, opening the follicles. They are helping the microbes, killing the microbes, but at the same time, they are damaging the normal skin. So they are drying. They dry the skin. So first use a wash-off treatment, and then after the client is comfortable, you can use a leave-on treatment. Leave-on, specifically salicylic acid, you can use it on the skin. And when someone comes with acne, ladies, If the acne is noticeable and you want to use one as a spot treatment, you can. But in many cases, you have to use the treatment on all over the skin, because the acne is not only on one or two or some spots. All over the skin is acne. So you need to use products all over the skin, unless on one specific occasion that you use acne products on as a spot treatment. Otherwise, it has to be all over the skin. So wash off products, you can use it as part of the cleanser you are using. So it's called cleanser. For instance, you have a cleanser, and cleanser with SA plus. SA stands for salicylic acid. Or you have products, cleanser with benzoyl peroxide. There are products that you can use them. You can use some of these. And the treatments happen mostly at night, not during the day, because during the day clients are active and they are doing so many things. So you can start with, let's say, one of these SA, salicylic acid or benzoyl peroxide, in the morning as a cleanser, and at the evening when the client is sleeping, you can use one of the leave-on product as leave-on for the night. Okay, these are good only for the closed comedone, open comedones, and papule. When it goes to the pustule, then you need a treatment, you need a medical intervention. It doesn't, salicylic acid and benzoyl peroxide may not treat them. And because there are so much damage, and the damage is happening in a very deep skin, these products may even damage even more the skin. So you definitely need antibiotics to kill the bacteria, to take control of the inflammation, and then go for this. Some of these treatments, like salicylic acid, some of them, they are good for prevention. So when you have a client that is a habitual acne and they get acne all the time, you need to use a kinds of treatment. That treatment is a prevention. You may use a exfoliation, a salicylic combination of salicylic acid and benzoyl peroxide as treatment, as a prevention of the treatment. One of the main treatment for medium, for all level of acne, essentially, one of the treatment is, probably you've heard about retinol, old tretinoin, or tretinoin. What does retinol or tretinoin do that makes such a wonderful effect of all acne? And you need to use these things on acne. They are retinol or tretinoin and different version of it, or there is another one which is called adapalene, or different is the brand. The brand different, or adapalene 0.1%. They are helping to release this retention hyperkeratosis, and also they are kinds of exfoliant and release this retention hyperkeratosis, and they are really works great for anybody who is acne and you want a preventive treatment. Using one of these depend to the type of acne and type of the client, retention type of the client. Retinol, tretinoin, or adapalene is really working. And Accutane or isotretinoin is another type of tretinoin. They are all derivative of vitamin A. Accutane or isotretinoin, what does Accutane and isotretinoin do is to stop the production of the sebum, and also to make the skin very thin, super thin. So when the skin is thin, there is not much sebum, there is not much exfoliation. So what's happened? There is no cause for acne, and that's why isotretinoin or acne is an effective treatment on very advanced acne, and nothing can replace it. Nothing can replace isotretinoin or Accutane on advanced acne. The amount of the number and amount of the type of treatment depend totally to the clients. Every client is different. If one client is good with wash off salicylic acid cleanser, then continue with wash off. If you have a client that your client is not responded to these things, then different or adapalene is a great choice. Yes, adapalene or different increase the cell turnover. Do you remember we talked about the cell turnover every 28 days on a young adult? Adapalene and all of this retinol, they decrease this 28, let's say, to 16 days or 18 days, something like that. So there is not enough time for the cells to get clogged together. These are all for juvenile or for teenage acne. The adult acne is a different story, is different treatment, as totally different things. So that's how we treat the acne on the spa, in the spa and med spa. So extraction, adapalene, differin, retinol, salicylic acid, P acne, and there are some other medications, some other treatment like tea tree oil. Tea tree oil, some people use it, but not necessarily. There are some topical antibiotic, but really topical antibiotic and tea tree oils, they are not they are working, they are perfect, but benzoyl peroxide does the same, this thing does the same, but the best treatment probably is exfoliation, salicylic acid, benzoyl peroxide if you see some inflammation, and also adapalene or differin and all these treatment. Now let's talk about the adult acne. What is adult acne? Adult acne is happening after age, or in the ballpark of in around age. Adult acne happen after usually about age 30, 35, depend to the kind of client, and it's all hormonal. Adult acne. So adult acne is a different story than the juvenile or teenage acne. And the reason for adult acne is cyclical change with the cyclical change of hormonal cyclical change that's happened. And the reason for adult acne in many cases, it says, is the consistency of the sebum is not like the acne. The consistency of the sebum changes. So the same follicle that used to be the same acne that used to be the sebum evacuate and leave the follicles very easily, when they are the consistency and when is increased, when the consistency and when the viscosity increase, they clog in. So the consistency is changed. Also the same things happen after a stress out or something like that. Also they may change the consistency of these follicle.